Welcome to VidaVital Medical. This video explains how to prepare and administer your prescribed ICP or ICI injection. It uses the auto-injector shown in your written instructions. This video supplements but does not replace training from your medical provider. Use only the medication and the dose prescribed specifically for you. Erectile dysfunction, also called ED, is a problem that prevents sexual activity because the penis fails to become erect or stay erect. Your provider has chosen Intracavernous Pharmacotherapy, or ICP, also called Intracavernosal Injection, or ICI. This injection contains a combination of up to 4 medications: papaverine, phentolamine, prostaglandin E1, and atropine. It is recommended you use this therapy 2 to 3 times a week with 24 hours between each dose. Never administer more than one ICP or ICI injection in a 24-hour period. Priapism is the medical term for an erection lasting longer than 3 to 4 hours. Tissue damage can occur should a prolonged erection go untreated. The most important method of prevention is limiting yourself to 1 injection every 24 hours. You must also discontinue Viagra, Cialis, Levitra, or other oral ED medications while using this therapy. If your erection is firm and lasting longer than 2 hours, stop all forms of sexual stimulation and apply a cold compress. Perform simple exercises, going up and down stairs, push-ups, jumping jacks, or air squats. Start with 120 milligrams of Sudafed and wait half an hour. If the erection has not subsided, take another 60 milligrams and wait another half hour. You should not take Sudafed if you are on high blood pressure medication. Should your erection last longer than 4 hours, you must contact the helpline at 888-681-1177. A hematoma is the swelling and bruising that can occur should you pierce a vein. Superficial veins that are visible must be avoided. After administration, hold pressure to the site with an alcohol pad. If bruising does occur, allow the area to heal before injecting near it again. Infection is very rare, but maintaining a sterile technique from start to finish is the only way to prevent it. Wash your hands, use a new syringe every injection, clean the top of the vial with a new alcohol pad, and clean the injection site. A throbbing discomfort is not unusual. A burning pain may indicate an allergy or improper technique, and VidaVital must be alerted. To prevent discomfort, no bent needles, no more than 1 injection every 24 hours, nothing above mid-shaft, and no excessive traction. Injecting repeatedly into the same site increases the risk of scar tissue and curvature. Alternate sides and rotate between 4 or more sites. Gather your medicine, a new syringe, alcohol pads, your auto-injector, and a needle disposal container. Clean off the table or counter before you put the supplies down, and wash your hands. Remove the cap from the medicine bottle and wipe off the rubber top with an alcohol pad. Remove the needle cap from your new syringe and do not touch the needle. Fill the syringe with slightly more air than the amount of medicine needed by pulling down on the plunger. Stick the needle into the center of the rubber stopper and push the plunger down so all the air enters the vial. Invert the medication vial and pull back slightly more medicine than needed, keeping the needle tip below the fluid level. Check for air bubbles. Hold the syringe straight up and tap the barrel with your knuckle, then take the needle out of the vial. There are 5 parts to your auto-injector, but only 3 are needed for use. The unnecessary parts are the yellow 2 to 12 millimeter tip, and the tip labeled J through R. These can be set aside or discarded. The tip labeled A through I sets your needle depth and needs to be connected to the syringe housing. Rotate the A through I tip counterclockwise until it rests just past A. Place the syringe housing squarely against the yellow plunger in the injector body. Push down until you hear a click and it can go no further. Remove the syringe housing, then insert the medication-filled syringe into it. Screw the syringe housing to the body of the injector, being cautious not to touch the firing button. Know your device: the A through I depth tip, syringe housing, injector body, yellow primer, red safety, blue trigger, and black plunger. Before injecting, locate your midshaft. You do not want to inject above your midshaft. Locate your midline, the 12 o'clock position. You do not want to inject along your midline. Locate any veins along your penis. You do not want to inject into areas with veins. The corpus cavernosum serves as the destination for treatment, and the 4 ideal spots for entering it are 2, 3, 9, and 10 o'clock. Among the 4, find one that does not have a visible vein overlying it and cleanse it with an alcohol pad. Grasp the head of your penis, not the skin, with your index finger and thumb. This will keep the skin along the side tight. Apply the auto-injector at the angle shown in your written instructions, using only enough pressure to remove the red safety. Confirm the red safety is no longer visible, then press the blue trigger. Hold the auto-injector against your penis and continue holding pressure as the black plunger descends and disperses the medication. If you remove the auto-injector before the plunger has dispersed all the medication, medicine will be wasted and sprayed from the syringe. You may remove pressure only when the plunger appears as shown in your written instructions. Remove the auto-injector and hold pressure immediately to the site with your alcohol pad for at least 2 minutes. Then start massaging your penis firmly from the head down. Dispose of your used syringe appropriately in a needle disposal container. Do not reuse your syringe. Before finishing, remember these important safety rules. Use only the dose prescribed by your medical provider. Never inject more than once in a 24-hour period. Avoid visible veins, the 12 o'clock midline, and any location above your midshaft. Alternate sides, rotate your injection sites, and use a new syringe every time. Contact VidaVital Medical if you experience burning pain, redness, warmth, swelling, drainage, unusual bruising, or other concerns. If an erection lasts longer than 4 hours, contact the helpline immediately at 888-681-1177. This video should be used together with your medical provider's training and written instructions. Contact your VidaVital Medical Care team with any questions or concerns.